There is a boy named Jojo who always visits the hospital because he wants to be a nurse someday. One day, he wants to know more about Dorothy Orem because he's seen it in the textbook of nurses. So he has his friend Leo, who's a nurse in the hospital, about Dorothy Orem. Leo, do you know Dorothy Orem? Can you tell me who she is?
Yeah, I can tell you more about her after my shift. Sorry, I have to go first.
Okay, I'll just wait in canteen.
Okay.
A few moments later.
Alright, Joe.
Are you ready?
Yes, of course. Where will I start? Back in the past, Dorothy Orem was born in July 15, 1914 in Baltimore. She was known as a nursing theorist and creator of self-deficit nursing theory. Her father was a construction worker and her mother is a homemaker. She was the youngest among the two daughters. Dorothy Orem was graduated in Seton High School, received diploma from Providence Hospital School of Nursing and Catholic University of America. She earned many honorary doctorate degrees at Georgetown University, Starkae World College, and Illinois. She occupied important nursing positions like the directorship of both the nursing school and department of nursing at Providence Hospital of Detroit, where she also taught biological sciences and nursing from 1939 to 1941. At the Catholic University of America, Orem served as assistant professor from 1959 to 1964, associate professor from 1964 to 1970, and dean of the School of Nursing. She also served as a curriculum consultant of the Office of Education in the United States. She was also given many awards during her career: the Catholic University of America Alumni Achievement Award for Nursing Theory, the Linda Richards Award from the National League for Nursing, and was named an honorary fellow of the American Academy. She was also received accolades for her contribution to the field of nursing. She also served as a chairperson of the Nursing Development Conference Group, and in 1973 edited the group's work in the book Compensatory. In 1971, Orem published Nursing Concept of Practice, the work in which she outlined her theory of nursing, the self-care deficit theory of nursing. The second edition of the Nursing Concept Practice was published in 1980. Orem retired in 1984, but she continued to work on the third edition, which was published in 1985. The fourth edition of her book was completed in 1991. She completed the sixth edition of Nursing Concept Practice in January 2001. She died on June 22, 2007 in Savannah, Georgia. Wow! Dorothy Orem is a super intelligent person and diligent woman in her time. Thank you, Dia!
You're welcome. Sorry, Jojo. I have to work, so I guess we can see again next time.
Thank you again, Leo!
Person defined by Orem as the patient, being the recipient of the nursing care, is a being who functions biologically, symbolically, and socially, and who has the potential for learning and development. a person is an individual who is with the capacity for self-knowledge, who can engage in deliberate actions, interpret experiences, and perform beneficial actions.
Health, a state characterized by soundness or wholeness of bodily structure and function. Illness is its opposite. It consists of physical, psychological, interpersonal, and social aspects. These aspects are inseparable. Health includes promotion and maintenance of health, treatment of illness, and prevention of complications.
Nursing meta-paradigm. ORM defines the art of nursing as an intellectual quality of the individual nurse. This quality is related to creativity as well as analysis and synthesis of information, all of which contribute to development of nursing system to assist individual or multi-person needs.
Environment consists of environmental factors, environment elements, environmental conditions, including external, physical, and psychological surrounding, and developmental environment. Environment can positively or negatively affect the person's ability to provide self-care.
Orem's grand theory of nursing is composed of three interwoven middle-range theories, which are self-care, self-care deficit, and nursing system. Self-care: activities that an individual completes or assists with in order to maintain life and or a higher level of well-being. Humans have an innate desire to care for themselves. Self-care deficit occurs when the demand of self-care is greater than the individual's ability to satisfactorily attain it. A deficit in self-care brings out a need for nursing care. Nursing system identifies actions that the nurse and client can take to reduce or eliminate the identified self-care deficit. This is where we'll see the role of the nurse and the client. This is Riley, a 12-year-old boy. He is in grade 6, living with both parents. Riley can independently respond in most of his self-care, like cleaning himself, taking a bath, changing clothes, and feeding himself. One day, Riley played outside and accidentally broke his right arm.
Nanay, pag uwi niyo ho, hayaan niyong gamitin niya yung kaliwang kamay niya para sa mga gawain dati niyang ginagawa. Para po maging independent siya. Kuya ha, pagkakain ka, gamitin mo yung kaliwang kamay mo ha.
Because he uses his right hand in all the things that he does every day, he needs to adapt. He needs to learn how to use his left hand to respond to self-care requisites, like the activities of daily living.
The theory of self-care deficit. This is the second component of Dorothea Orem's theory. This theory specifies when nursing is needed in a situation where nursing is required when a person is incapable or limited in the provision of continuous effective self-care. There are 5 methods of helping under the self-care deficit. The patient above is a postpartum mother. Only her and her baby is in the room. Number 1. Acting for or doing for others. The nurse is reviewing the patient's charts as part of her assessment if the patient is able to go to the bathroom as per the doctor's instruction. Number 2, providing an environment promoting personal development in relation to meet future demands. Number 3 method is teaching another. Number 4 method is guiding other. Number 5 method is supporting another. Self-care deficit is that the nurse assessing and determining why a patient is unable to perform insufficient care, as well as educating the patient in how to perform better self-care.
The wholly compensatory nursing system is represented by a situation which the individual is unable to engage in those self-care actions requiring self-directed and controlled ambulation and manipulative movement, or the medical prescription to refrain from such activity. Persons with these limitations are socially dependent on others for their continued existence and well-being. Infants, neonates, and patients in coma are patients that need the wholly compensatory nursing system.
The partly compensatory nursing system consists of the provision of some care when the patient can perform some, but not all of the needed self-care activities. The nurse cares for the needs that the patient cannot do on their own.
Supportive educative system. It is used when a patient can meet self-care requisites but needs an assistance with decision making, behavior control, or knowledge acquisition skills. It is when nurses communicate with the patient and inpatient family. This is one of their ways in order to help the patient achieve a quality of life. effective educative to the patient, wherein they guide and educate them with the things that they are confused in. In this system, the nurse attempts to promote the self-care agency.